If fried chicken is your favorite, just go eat. Because you cannot be picky about the food, you just need to eat. Like I exercise regularly and I try to eat, not very clean like that time, but I try to eat properly with proper nutrition and good portions of proteins, carbohydrates and fiber, plant, fruits. During treatment, I actually took protein powder because we know that protein is the fundamental nutrient to build tissue, to build cells. I will avoid raw food, during treatment, no salad, nothing uncooked, unwashed, just to reduce risk of cross-infection, and everything must be fully cooked. So, being a Chinese, being Asian also, right? Every time you go through a surgery or have cancer, there are a lot of well-wishers with very good intentions. Everybody telling you, impart you with advices about what you can eat, what you cannot eat, what you should absolutely stay away from. So, like for example, you would probably want to avoid crustacean because it's highly allergenic, so it might cause rashes or skin itchiness or maybe interfere with the healing of your wound. But theoretically, I eat everything, and like I said, I focus a lot on protein intake. So, because to me, protein is very essential on your tissue building, and you want to recover fast. Although I'm on a plant-based diet, I mainly take fish, some chicken sometimes if I cannot find fish. Mainly it's tempeh and tofu, a lot of avocado, and I actually take a lot of soybeans. So I do my own smoothie in the morning with a cup of soy, and it's also part from my readings that isoflavone from the soybean actually helps with patients like us and to help prevent cancer, prevent osteoporosis. That will be my vital intake for the day, my protein intake for the day. I don't remember having very good appetite post-surgery, but I do force myself, if I may say that, to eat. And I know because a lot of times you totally have no appetite, so you might only eat a little bit of broth or whatnot, but I do actually take those, something like a full nutritional beverage, just to make sure on a daily basis I have sufficient intake of necessary or essential nutrients to make sure I have a good recovery. When my appetite starts to come back, I will just eat. Like whatever my body tells me that I need to eat, I will eat. It can be a burger, so I'll go for burgers because I can eat. If fried chicken is your favorite, just go eat. Because you cannot be picky about the food, you just need to eat. So you have strength to recover. When you feel better, exercise. Because your joints will be painful, your body will feel weak, but light exercise actually helps you cope, and it's scientifically proven it actually helps you cope with side effects from chemotherapy. Now this is taking care of yourself from a physical level. There are actually a lot of resources online. Even if you go through reputable cancer website, they actually do share in terms of like what you can eat during treatment and whatnot. Yeah, there are a lot of free resources, and on Facebook I usually follow a few nutritionists locally that you need to evaluate yourself. Like you will listen to their some of their clips or read their articles, and you feel that they are reputable. Some of them are pretty reputable, and you would either enroll their courses. But I don't in general say that we should pay money but sometimes if you want to learn something, you will pay to learn. I still feel that during treatment, it is more important that you can eat, so you just eat anything that you can, rather than try and manage what you should eat or should not eat. Like I said, I always say, have that beef burger because that's the protein that you can eat. It's more important that you have that protein rather than say, oh, you cannot eat meat, and then you deprive your body of that vital nutrition to recover. It doesn't mean that, oh, if there is meat, I don't eat. If I go to a restaurant, I'll just find something that I can eat. Worst case, I'll take a salad with some eggs, right? You can always find food that you can eat
if you look for it, right? So, and you, with that mindset, then it's not so restrictive because you can technically go anywhere and still find good food that you can enjoy. If you really cannot eat, then I think maybe you should just tell, hey, can we go somewhere else? If you're a little bit strict about your diet. But in general, I don't. I'll just find what I can eat wherever I go. So it becomes easier for people to also plan to come out with me and whatnot. A lot of people tell you, oh, don't eat this. Oh, cannot eat that. This one is poisonous. To me, I've been reading, I think during treatment, you're already so difficult, you're already in pain, you can barely move. I think more importantly is just eat something that makes you feel good, right? Give you energy. Of course, don't forget your protein. If a burger makes you happy, go whack the burger. It's okay to occasionally have that burger or that bachang, but if most of the time you're eating very healthily and taking care of yourself, you should be grateful that you can eat at all. So what you eat doesn't really matter, just eat.